All right, so I want to take you now to KwaZulu-Natal. One of the biggest COVID-19 projects in KwaZulu-Natal was the building of a quarantine site at Clairwood Hospital in Durban. It cost government 225 million rand. Now that COVID-19 admissions are declining, what will be the facility used for? What will it be used for? Some are questioning if it was worth spending that amount of money on a temporary structure. Well, these are some of the questions authorities will have to answer when visiting the facility this morning. Let's bring in SABC reporter Simphiwe Makhanya, who's covering the story for us. Simphiwe, a very good morning to you. Tell us more.
Morning to you, Blaine. Certainly, those are some of the questions that the Premier of KwaZulu-Natal, who is just next to me, is going to answer as he visits this Clairwood Hospital, which is one of many health institutions in the province that are currently being renovated during this time of COVID-19. Premier, a lot of money was spent in this project, over 200 million rand to be exact. What is going to happen when the institution itself is no longer receiving patients for isolation and quarantine?
This is one of the legacy projects, and we would want to applaud the department. We've built a new building, and what is going to happen here is that after COVID, it will remain as a hospital. It will continue, and it is bringing the NHI, the National Health Insurance, will be easily implemented based on the infrastructure we have built here. So it is still going to serve as a health facility.
Premier, another issue is the issue of us now as a country being on level 2. That obviously will increase the risk of infections. What sort of practical interventions is the provincial government going to embark upon to ensure that the risk of new transmissions is reduced?
We will continue to enforce protocols, including encouraging people to follow health protective measures such as washing of hands, sanitization, social distancing, compulsory wearing of masks. We're going to continue with that. We're going to monitor areas such as work areas, your companies and factories. We will monitor whether they are following the protocols as they are, but also to assist the communities as expected.
Premier, during this time of COVID-19, we have had incidences in Gauteng and other provinces as well, where there were allegations of corruption with regards to the procurement of PPEs to be exact. In the province of KwaZulu-Natal, have you received any of those reports? And if so, what are you doing about them?
We did take actions on the issue of the PPEs and blankets in the Department of Social Development. We've gone public to release the report publicly of all people who were doing work for government as companies. So we are going to take actions. If there is an allegation, we investigate and take actions. We're not going to compromise on that.
Coming back to this hospital, Premier, 200 and something million rand sounds like a lot of money. Is it worth it?
I will say it's worth it. There is a new building here that has been built. The hospital has been renovated, the hospital as a whole. So it's worth it. 232 million, which have gone into the investment in revamping this hospital. This has been a dilapidated hospital where people were no longer willing to come here, but now it is one of the best in the province.
Is it currently being used for isolation? If so, do you know in terms of the figures how many people are actually being quarantined or isolated in this hospital?
I'm sure the Department of Health will help us with the details of the numbers that you are requesting, and I think we'll consult them.
Okay. Premier, thank you very much for your time.
Thanks a lot, and thanks to the viewers.
Okay. That's the Premier of KwaZulu-Natal, Mr. Simphiwe Makhanya, saying that the provincial government here in KwaZulu-Natal has invested over 200 million rand in revamping this very old Clairwood Hospital. Blaine, it's back to you in Johannesburg for now.
Simphiwe, with regards to the latest figures I have in front of me, KwaZulu-Natal has the second highest percentage in terms of the total number of cumulative cases of COVID-19. It's about 18% of the South Africa's total number. It's just Gauteng is obviously the epicenter at this stage at 33%, and then it is KwaZulu-Natal, then the Western Cape at 17.4%. I want to get a sense of where the head and hearts of people in KwaZulu-Natal are at with regards to the level 2 move. Tests, no doubt you testing the temperature of views on the ground. What's the sentiment on the ground with regards to this move down to level 2?
Well, certainly it's good news, Blaine, for business people such as, those who own health fitness centers such as gyms, because you would understand that previously in the previous level they were not allowed to operate, but with this new, obviously, level 2, they are now allowed to operate, which will sort of save their businesses from going under. But obviously the risk, Blaine, is still there. The fact that we are on level 2 does not necessarily mean that we are out of the woods as yet, because infections are still being reported on a daily basis. So the people on the ground are basically saying, even though they welcome this sort of new freedom, if I may put it that way, but obviously it comes with a huge responsibility of ensuring that people do adhere to these regulations to curb the spread of the virus in the province.
Yeah, and in this case, complacency will be the enemy of progress with regards to the fight against COVID-19. Simphiwe Makhanya, as always, thank you very much indeed, sir.